background levels of immunity that we have here relative to other parts of the country. Let's start with climate. There are two things going on right now, particularly in northern New England. The first is that as it gets chillier, more and more people are out inside versus outside. That in and of itself puts people in closer proximity with less airflow, less UV light. Right off the bat, we have a chance for more transmission. But the second thing that happens in the winter is drier, cooler air, which for any respiratory virus means that the virus can hitch a ride and travel that much further from person to person, thus increasing the ability of the virus to spread. So those are two climactic factors that are happening, not just in northern New England, but in Montana, Wyoming, the Dakotas, across the northern belt. The second factor that's continuing to drive cases in Maine is the composition of vaccination overall. We've talked about this before, but imagine two identical states, identical in every way. And in both states, 2/3 of the population are vaccinated. But in one state, it's 2/3 of, say, the northern part of the state that is vaccinated, and the southern part of the state is completely unvaccinated. But in the other state, the mirror image state, it's 2/3 of people vaccinated, but instead of it being across a tight geographic line, it's 2/3 of every single household. In that latter state, the virus, if it gets introduced, has no room to run. But in the former state, where there's a tight geographic boundary, a bright line of vaccinated versus unvaccinated, the virus can still rip through unvaccinated parts of the state. That's akin to what we're seeing in Maine. Highly vaccinated parts of the state with highly unvaccinated parts of the state. The third factor is background immunity. In the unvaccinated pockets of Maine, the background level of immunity from the virus is extremely low. And that's because Maine never experienced the massive surges that other parts of the country, be it Boston, New York City, or even Florida, experienced. What that means is that in those rural, unvaccinated parts of the state where there is no background immunity, when the virus gets introduced, it is metaphorically and almost actually like gasoline with fire. It just tears through, and with no immunity to stop it, it keeps going until it stops on its own. So I think in general, those are the reasons why, notwithstanding our high vaccination rates, we continue to see high case numbers.
I've seen a map of the state of Maine, county by county, and boy, really a different story, county by county. Places like Cumberland County, almost no cases, and then other places, I think it's the Portland Press Herald did a county by county map going from red to white, in some counties red, in some counties white, not variations of pink and orange.
It's quite binary in that respect, and unfortunately, even though it's helpful on an individual level for people to be vaccinated, there's no question about that. If we want to talk about slowing down the march of the virus, we need to get folks in the, as high as possible, 70, 80, 90% of communities fully vaccinated to start slowing down the virus. And what we're seeing in rural parts of the state is that there is no immunity at all, either from the vaccine or from pre-existing infection. Unfortunately, Jen, and I hate to deliver bad news, but when there's bad news, I want people to hear it from me. This trend that we're seeing of a high plateau of cases, hospitalizations, and deaths is likely to continue because these same epidemiological factors, although they will eventually abate for the foreseeable weeks, they're not likely to change. And thus the high levels of cases that we're seeing are almost certain to continue.
Dr. Shah, one of the reasons we're doing this program today, one of the reasons you're on this program today is because we have had the approval of the vaccination for children ages 5 to 11. Some parents very excited to have this news. Some parents already trying very hard to figure out where they can have their children vaccinated. I've seen on social media already people celebrating that they have found somewhere to have a vaccination for their child. Other parents really concerned, really nervous about the idea, especially for younger children. What do you have to say to parents right now facing this choice? Should I have my child vaccinated?
The answer to that question is yes. Vaccinating your child is a great, smart, sensible thing to do in the midst of a global pandemic. But it's completely reasonable to have questions as a parent. Indeed, you wouldn't be doing your job as a parent unless you asked tough questions. Is the vaccine safe? Does my child really need it? Let me talk about both of those things. Let's first talk about the vaccine itself and the benefits for your child in getting vaccinated. And I like to think about that on three lines or three axes. The first benefit is to the child themselves. It keeps them safe, it keeps them healthy. Throughout the pandemic across the United States, we've had close to 100 children between the ages of 5 and 11, this newest group. We've had close to 100 children across the country who have died from COVID-19 throughout the pandemic. And the thing is, Jen, kids aren't supposed to die. 100 deaths from an infectious disease is unconscionable. If those deaths had to occur in 2019, which is the last year we have these data available, COVID would have been the 8th leading cause of death among children 5 to 11 across the country. And that's because kids aren't supposed to die. We have a vaccine now that prevents that. The second benefit of getting your kid vaccinated is that others around them will have that much safer of a, say, holiday weekend or holiday season, something I know we're going to talk about. If your family is planning a gathering, well, there will be a mixed group of, say, grandparents as well as younger children. Having your child vaccinated not only protects them, but it protects those individuals who may have other vulnerabilities, like older grandparents, et cetera. The third reason to get your kid vaccinated is for the latter half of the school year. The more kids who are fully vaccinated going into January, the much more normal the latter half of the school year looks like. Things like quarantine, all of those things can be avoided when someone is fully vaccinated, something I think we can talk more about. But that being said, I know that the benefits alone don't make the case entirely for the vaccine. A lot of it's about safety, and parents have a lot of reasonable questions about the safety. We can talk more about it as folks call in, but the bottom line here is that this vaccine by Pfizer was studied in over 4,000 people. They were followed for quite a period of time and continue to be followed. And the most common side effect that was uncovered was a little bit of pain at the injection site, maybe a little bit of fatigue. Indeed, this younger group of kids, 5 to 11, don't even have the fever and chills that older kids and adults have. Based on everything we know about this vaccine and the fact that it's been given hundreds of millions of doses around the globe, we have every reason to believe and trust the safety. You know, Jen, I'll stop with this. Every single pediatrician, family doctor, and nurse practitioner that I've talked to in recent days, weeks, and months has said uniformly, when this vaccine is available, which it is now, they themselves were going to have their kids aged 5 to 11 vaccinated. These are the people that society entrusts to care for kids. If we trust them with every other medical decision, my view is that we should trust them for this vaccine.
Dr. Shah, you mentioned we are going to the holiday season. Many families making their Thanksgiving plans already have made their Thanksgiving plans. It's only a couple weeks away, 2.5 weeks away. What do you advise as people look forward to perhaps gathering for the first time in a couple years with family members?
Well, first of all, bottom line up front, Jen, those gatherings should happen because there are ways, which I'll talk about, to do the holidays in a safe manner. As you said, we're not far out from Thanksgiving, Hanukkah a couple days thereafter, and then we have the December holidays on top of that. There are ways to do those holiday gatherings safely. The first question on the table, and I want to try to give concrete advice on how to do so. The first question on the table, the most important question on the table, is will everyone attending that gathering at your household be fully vaccinated? And by everybody, I mean everybody. And by fully, I mean fully. I mean every single person more than 2 weeks after their final dose. And if the answer to that question is an unequivocal yes, that everyone will be fully vaccinated, then that celebration, that gathering can continue as it would have during pre-COVID times. It can be, for all intents and purposes, a normal family gathering, or at least in my family, as normal as family gatherings can be. But I suspect that's not the case for everyone. What's more likely to happen this holiday season is that there will be hybrid gatherings where some people are fully vaccinated and other people are partially or not vaccinated at all. There you have to start asking some tough questions. For example, are the unvaccinated individuals, what are the vulnerabilities that they come to the table with? If they are not fully vaccinated and may be immune compromised, then that counsels in one direction, a very cautious direction. But if they're just not fully vaccinated, the first thing that I'm asking families to do, and this is hard, but I think it's important. The first thing I'm asking families to do is talk to the folks who aren't fully vaccinated. Now, no one likes to have that conversation. It's a difficult conversation to ask a family member to go get vaccinated. The thing is this, difficult conversations can pay off. There was a recent study that showed that about 30% of unvaccinated adults change their minds because a family or friend asked them to get vaccinated. Is it an easy conversation? No. Does anyone look forward to it? Of course not. But can it work? Absolutely. So the first thing I'm asking everyone to do is to have that tough conversation, because it could mean the difference between a safe versus unsafe gathering. Now let's go back to the hypothetical where not everyone is fully vaccinated. You've got a hybrid group. You maybe have a couple 2 and 3-year-olds, and then maybe older folks who aren't vaccinated. What else can you do? Well, the second thing after having that tough conversation is testing. Testing, testing, testing. The more you can test folks before they get in the car, before they hop on that plane, before they walk in, the safer the gathering will be. Now, these rapid tests, they're still a little bit tough to find. I acknowledge that, but they are available. The Walgreens in our neighborhood does carry them. They're available online now. So they are out there, and the availability will continue to get better. Testing everybody, vaccinated and unvaccinated, but especially the unvaccinated, before they leave, before they hop in the car, before they come in the front door, makes the gathering that much safer. And then finally, on top of all of that, there's the usual layers that we've talked about throughout the pandemic. Masks work great, even inside. Outside is better than inside if that's available to you. If you're going to be inside, masking plus airflow is really key. Opening up windows, getting a lot of air circulating, which might help with letting off some of the smoke from cooking. All of these things will really help make the holiday gatherings that much safer.
All right. And finally, before we go to some calls, some questions about booster shots, Dr. Shah. I know that booster shots are available, becoming really widely available. A whole lot of pre-existing conditions are listed, but the reality is it's pretty darn easy to get a booster shot right now, isn't it?
It really is. I've seen reports, I've seen on social media, for the most part, folks who are looking to get a booster have been able to. And here's the bottom line with the booster. There are categories of folks who qualify. If you're over the age of 65, if you have a pre-existing health condition, if you work in an environment where you're in person and could be exposed or expose others to the virus, getting a booster is a smart thing to do. I think about it in terms of the other smart things you should do to take care of your health this winter, making sure you're up to date on your flu shot, getting your COVID booster. And as you noted, Jen, the list of pre-existing medical conditions that qualify for a booster is quite expansive. Everything from being a bit overweight, having anxiety disorder, having diabetes, conditions that when you look around, a lot of folks have. So if you're out there wondering, gosh, I'm 38 and I guess I don't qualify for a booster, I'd urge folks to take a look at that list of medical conditions or think about your workplace, because for a lot of people in the state, they already qualify.
We are going to take a quick break. We're speaking with Maine CDC Director Dr. Nirav Shah. We will have some of your questions for Dr. Shah when we come back. This is Maine Calling.
Listener support brings us Maine Calling with help from the PMA's Title Shift Award, a prize for young artists who are focused on solutions for climate change. Learn more at titleshift.com. By the law offices of Joe Bornstein, Maine lawyers committed to helping injured Mainers since 1974. Learn more at joebornstein.com. And Evergreen Home Performance, a locally owned energy efficiency company with career opportunities available. Details at evergreenyourhome.com.
Shipping costs right now, they are just too darn high.
The cost of the particular product is fantastic to import, but the cost of importing, I just can't justify it.
I'm Kai Rizdal. To import or not to import, that is the cost-benefit calculation. Next time on Marketplace.
Marketplace this evening at 6:30 here on Maine Public Radio.
For business owners across Maine, Maine Public's audience is your audience.
I'm Ellen Tracy. We're here at Eastern Mold Remediation in Eastern Basements. We're a family-owned and operated business. We started with Maine Public 5 years ago. Maine Public has been the most successful aspect of our marketing efforts. I just can't say enough good things about our experience.
Visit us at mainepublic.org to get started.
And welcome back. I'm Jennifer Rooks, and this is Maine Calling. Today, our guest is Nirav Shah, who's Maine's CDC Director. We are talking about booster shots, vaccinations for kids, flu season, and advice about the ongoing pandemic. I'm sure Dr. Shah would like to take a question about something else as well. So you can send an email, a brief email to talk@mainepublic.org, tweet @Maine Calling, post a comment to our Facebook page or to Instagram, or give us a call. 1-800-399-3566. We'll go to Laura, who's calling from Saco. Hi, Laura. Go ahead.
Hi there. Thanks for taking my call. Wow, I haven't listened to Maine Calling for well over a year. So I find this to be very interesting, and I understand you probably have a lot of calls. The comment I want to make is that I find Dr. Shah's advice regarding vaccines for kids to be absurd. In my estimation, from just what I've seen in the last couple months, the people who are getting sick, whether it's COVID or colds or whatever else, are the ones who are vaccinated. And in no way would I ever subject my children to something that, one, doesn't work, two, may cause more harm than necessary, and three, is an unknown. And to be pushing it on kids, I just find to be morally wrong. And,
Laura, can I ask you where, it's interesting, where are you getting your information?
I'm just looking around. I'm just seeing many of my neighbors who are elderly dying recently. I've had 3 people in my neighborhood die recently. Post-vaccine, I've seen any number of blood illnesses, neurological illnesses, cropping up everywhere. My daughter is in college. She's unvaccinated, and her friends who are vaccinated and are wanting to get boosters, and some have already gotten boosters, are the ones who are getting so sick, and they're ending up in urgent care for small colds. It just seems absurd to me, and it seems absurd to her, because they all get a cold together. She gets a sniffle, and they are just like wasted for like a week.
All right, Dr. Shah, go ahead.
Yeah.
Well, Laura, I hear what you're saying. There's a lot of folks out there that are concerned about the vaccine. They're concerned about the safety. They're concerned about the effectiveness. And I'll talk about some of those points in a second, but I think the fundamental question comes down to right now in Maine, with our continued high case counts, what's the bigger risk? Is it the virus or is it the vaccine? And you raised questions about whether the vaccine works and whether it's safe. And you suggested that a lot of the people that you're seeing who are getting sick are in fact vaccinated. And it's true, there have been breakthrough cases. But as of this morning in Maine, we've had about 10,000 breakthrough cases. And you have to compare that against the vast number of individuals, about 950,000, who have been completely vaccinated. To put that in perspective, 99% of people in Maine who are fully vaccinated have not gotten COVID. Now, it is the case that individuals who are fully vaccinated can sometimes have a breakthrough case, and they can sometimes land in the hospital. Sadly, some of them can even pass away. Those individuals tend to be on the older side, and they tend to have other health conditions. On any given week in Maine, of the people that are in the hospital because of COVID-19, anywhere from 60 to 75% in any given week of people in the hospital with COVID-19 are not vaccinated. It can happen that a vaccinated person needs to be hospitalized, but the overwhelming majority of folks are those who are unvaccinated. And finally, you raise questions about safety. Totally reasonable. I'd say that's the number one question that's out there on people's minds. Is this vaccine safe? And we're at the point now where hundreds of millions of doses of these vaccines have been given just in the United States. Billions have been given around the globe. These vaccines are probably the most studied, most monitored medical intervention that has ever existed. Based on everything we know, not only do the vaccines work, but they're also remarkably safe, especially given the continued high numbers of cases that we've got. I hear what you're saying. I want to take your question respectfully, but those are the facts.
And Laura, I do so much appreciate you calling in. And Dr. Shah, I think this is something that's so difficult. I think for public health experts, for so many people in the community, because people, almost 2 years into this thing, people do know people with specific experiences.
It happens, and our brains are conditioned to base our understanding of the world not on abstract data from a paper that's published somewhere, but based on what we can see. I mean, who do you believe, me or your lying eyes, right? This is how human nature works. And so, yes, it is the case that a lot of folks see people who have been vaccinated and getting sick and ask themselves, well, wait a minute, I thought this vaccine was supposed to stop all of that. How does that compute? It's a totally reasonable question. No vaccine is 100% effective. Indeed, because Maine has so many vaccinated people, breakthrough cases are more common here. In a state where there are not that many vaccinated people, comparatively, your likelihood of bumping into somebody who's vaccinated and has a breakthrough case is that much lower. But because Mainers are generally among the most vaccinated, as a result of that, it's called the base rate effect. There are a lot of breakthrough cases among people we know. This is why scientists don't base policy decisions on anecdotes. This is why we do randomized controlled trials. This is why there's peer review, to look out for these biases that can color the way that we think, so that the decisions that we make are ones that are based on science rather than intuition or perception.
Would it be helpful in messaging, and has it been done to have run models of what would it look like today if there had not been a vaccine developed?
There have been models that have looked at that. If we assume that the Delta variant would have come along at the same time, I haven't seen the model specifically for Maine, but they've been done for the United States as a whole. And as I think you can imagine, the number of deaths that we would have sustained, the number of people hospitalized, the number of new cases would have been too much for any of us to bear. It's almost a certainty that hospitals across the Eastern Seaboard would have been completely overrun had it not been for the beneficial effect of the vaccine.
An email here from Marie. I'm the parent of a 5-year-old in Hancock County. Our pediatrician's office doesn't know when they will give the COVID vaccine. They suggest making an appointment and hoping it might be available when we get there, but that's a big gamble to take time off work and drive a 2-hour round trip. Our pharmacy says the same, or they won't do under 12s yet. The hospital vaccination clinic lets us book on the confirmation of 12 and over. Not everyone will keep going with this many roadblocks. What can you do to make this easier for parents?
Well, it's getting better day by day. More and more sites, be it pharmacies, doctors' offices, and hospitals, are coming online. As of this morning, we had about 82 places in Maine that were offering the 5 to 11 vaccine. And that doesn't even account, Jen, and to the emailer, doesn't even account for the school-based clinics. So it's probable that in an area near you, your child's school or adjacent school district will itself be hosting a vaccine clinic in the coming weeks, to say nothing of your doctor's office, the area hospital, and pharmacies. Some of the places are making sure their IT systems are ready to go to account for this change. Other places are receiving the vaccine last week and this week. So I anticipate that the availability of the vaccine will continue to increase over the coming days, over the coming week. I recognize it's frustrating. As you said, people can only deal with so many roadblocks before they throw up their hands in despair. I get that. I hear that. It is getting better. In the meantime, I ask for a bit more patience while all of these places get up and running.
An email here from Susan. I had the J&J shot in March of 2021. I had a Moderna booster shot on November 2nd. My doctor recommended I get the Moderna series, both shots, but the pharmacist says I can't get the second Moderna shot. Can I? I'm 68 years old.
You don't need the second one. The data that we have suggests that the one single Moderna booster on top of the J&J shot that you got back in March does the trick. It fully activates and primes your body's immune system without needing to go through the second Moderna shot. So having had that Moderna booster on top of the J&J vaccine, you should be in good stead. And strong work for getting the booster. That's great.
An email from Nancy. Please address the use of ethylene oxide on the swabs of PCR tests. It's known as a carcinogen. I believe testing is another answer to fighting COVID, but I am no longer comfortable with the only reliable test being a carcinogenic.
So this is not exactly accurate. And I want to make sure I'm being clear and correcting the record here, or making sure the facts are out there. Ethylene oxide is a colorless gas that is used to sterilize medical devices and products like nasal swabs, so that if you're using it to conduct a test, you're not accidentally introducing a different bacteria or virus. There have been concerns that it may be linked with certain cancers. None of that has necessarily been shown to be the case for the small amount of exposure that you might get from rolling a nasal swab around your nostril for a second or two. If it were up to me, again, or in my case, the big question on the table is what's the bigger risk? The theoretical risk from cancer related to a bit of ethylene oxide gas on a swab, or the very real risk of experiencing COVID-19 and spreading it to others by delaying testing. I know you're on board with testing based on what you said. I would not let the concern around ethylene oxide be a reason to delay or be deterred from getting tested.
All right, we're going to go to Vinny, who's calling from Brownfield. Hi, Vinny, go ahead.
Hi, thank you, everyone. I appreciate it. I've been vaccinated. I was wondering if you could rank which vaccines have the highest hospitalization breakouts. Also, which vaccine, a booster, lasts the longest? And my third question is anybody contact tracing for the outdoor events this summer and for airports? Thank you.
Okay. Well, Vinny, thanks. I'm glad you got your vaccine. That's great to hear. Let's take those questions in reverse order. Let's start with contact tracing. Yes, we are continuing our contact tracing and case investigations. Those efforts haven't slowed down. We're still doing it. We haven't seen any definitive signals from, say, the outdoor events that you mentioned over the summer. Generally speaking, that experience reinforces what we've known about outdoor events, which is that they're resoundingly safe. In terms of the boosters, the national data around boosters, or even just the vaccines in general, has not revealed significant differences among the boosters in terms of their effectiveness, either at preventing new cases or at eliminating disease. And here's what I mean by that. The Moderna and Pfizer, when acting as a booster, result in a quicker and more pronounced bump in your immune system than a booster of the J&J vaccine. So you might be thinking, great, problem solved, case closed. When I go for my booster, I'm going to get a Moderna or Pfizer shot. Done and done. But here's the other side of that. The same set of early data suggests that maybe the duration, now getting to your second point, the duration of that immunity might, emphasis on the word might be a little better and longer lasting with the J&J shot. Right now, the final data aren't in, and they won't be in for quite some time because those studies are being done. So what does that mean? For folks who are out there looking to get a booster, wondering which one they should get, my answer remains the same, which is it's more important that you get a booster rather than obsessing about which one you get. If you feel better having gotten the J&J and mixing it up a little bit and getting a Moderna or Pfizer one, that's not a wrong answer. If you got the J&J and you liked it and you did fine with it and you trust that brand and you trust that company, and that's what you want to get for your second one, there is nothing wrong with that either. Again, it's more important that you get a booster rather than being obsessed with which one you get.
Vinny, thanks for your question. We're going to go to Sandra on Twitter. She asks, if the infection rate has remained so high, why haven't we mandated masks again indoors, especially now when the colder weather is starting?
Sure. It's a great question. And here's what we've seen as we've taken a look at where the transmission is happening. Because the fundamental piece of analysis to that question is not so much whether or not to wear a mask indoor. You should, all across Maine. But from a mandate perspective, we would have to know that the transmission, the bulk of transmission, were occurring in places where the mandate would be effective. And right now, what we are seeing when we look at people who have gotten COVID, particularly in rural parts of Maine, when we talk to them, is that overwhelmingly they're getting COVID in private social settings. They're not getting it at Walmart. They're not getting it at the grocery store. They're getting it because they were hanging out with their friends in places where the masking wouldn't be effective. So we've got to ask ourselves a tough policy question, which is right now, where are we going to get the maximum benefit from any particular lever that we might pull? Right now, based on where we are, the maximum benefit comes from urging folks to get vaccinated. Do I want folks to wear a mask? 100%. I think every single person in any public indoor setting in Maine should be wearing a mask because it's a smart thing to do. If we were to mandate it, we'd have to ask ourselves, what were we doing with that? Because the bulk of the transmission continues to occur in private settings rather than public ones. Given what we've got and the bandwidth that we have and our ability to affect change, my view is that we get the maximum public health benefit from talking about and focusing on vaccines.
Dr. Shah, Dr. Nirav Shah is our guest today on Maine Calling. We do need to take another quick break. When we come back, more of your questions for him. We'll be right back.
Listener support brings us Maine Calling with help from the UMaine Alumni Association, presenting Black Bear alumni, their economic and community impact, available at umainealumni.com, and BCM Environmental and Land Law, focused on Northern New England environmental law and land issues, bcmenvirolaw.com.
I'm Scott Tong. People in Black and Brown communities are routinely getting less sleep.
Noise is a problem. Light pollution is a problem. Temperature fluctuation in those high-rise buildings in Brooklyn, New York are significant problems.
Health officials say sleep inequity can have serious consequences. That's next time on Here and Now.
Here and Now coming up shortly after Maine Calling from 12 noon until 2 here on Maine Public Radio. Have you subscribed to The 10? The 10 is Maine Public's weekly e-newsletter that takes a closer look at 10 exceptional, thought-provoking, and compelling stories. These stories are not necessarily from the week's headlines. In fact, most are stories that you may have missed from Maine Public, NPR, PBS, the BBC, and more. To sign up or to check out past issues of The 10, please visit mainepublic.org.
And welcome back. I'm Jennifer Rooks. You are listening to Maine Calling. Today, Maine CDC Director Nirav Shah is back to answer your questions. So many coming in, but if you want to try to get in, you can call 1-800-399-3566. Again, 1-800-399-3566. We're going to go to Joe calling from Harpswell. Hi, Joe. Go ahead.
Hi, good morning. Thank you. Good morning, Dr. Shah. According to the Maine CDC website, your mission is to provide leadership, expertise, information, and tools to assure conditions in which all Maine people can be healthy. And I'm wondering, given that, I'm perplexed, continually perplexed at why the CDC chooses to spend zero energy, $0, and pay zero attention to the multitude of low-cost and no-cost things that each person can be doing to keep themselves healthy in terms of their diet, exercise, vitamin D levels. I'm an organic farmer and pay a lot of attention to our connection to, all these natural and effective aspects of keeping ourselves healthy. And I just wish you'd I'd just like you to comment on that. Why is it that you spend? I mean, you talked about how to stay safe at Thanksgiving. You talked about the levers that you can
Okay,
pull.
Joe, we're going to try to go
these
quickly. Go ahead,
low-
Dr. Shah.
Sure. Well, Joe, I think you and I agree that staying healthy, it depends in part on having a good diet, making sure you're exercising, doing all the things that folks should do. And we have robust programs around each of those things across Maine CDC. The question isn't whether we do one or the other, though. The question is, how can we maximize both of those by combining them? Our view is that by encouraging folks to stay healthy through a good diet, helping them exercise, plus being able to access some of the best available medicines out there and vaccines, we can actually maximize individuals' health. We don't see it as a simple either or. I think for us, it's about blending the two so that every single person can sort of attain that maximal health.
Joe, thanks so much for your call. We'll go to Jeff from Wiscasset. Hi, Jeff. Go ahead.
Yeah. Hi, Dr. Shah. Thank you for answering questions. I wanted to ask if this vaccine for the children, it will include a package insert or any indications to the parents or those taking it, what the risk-benefit analysis is, and also whether it will include information that lets them know that the formulation that they would receive, particularly at doctor's offices, is not necessarily the same formulation that was tested, meaning they altered the formulation so that it could be refrigerated for 10 days and not be in a deep freeze. And when asked at the committee meeting of the FDA that analyzed it, the Pfizer people, even with their chemist, could not really answer the question as to what that new formulation was. And when asked, did they test it in the trial, they said no. So I'd love you to comment on that, because I think lots of parents should understand. Thank you.
Well, I agree that parents should understand the facts around this vaccine. So let me provide those facts. Number one, this vaccine that's been authorized for children 5 to 11 does have a different buffer. It's a buffer that's been used in countless other pharmaceutical preparations for decades now. And the reason that Pfizer switched to that buffer is to allow greater shelf stability. The new version of the vaccine for children 5 to 11 can now be stored in a refrigerator for 10 weeks. You'll recall, the original formulation of the Pfizer vaccine had to live in a -80 ultra cold freezer, which are not widely available in rural Maine. So that's the reason the buffer was changed. And you are incorrect. This version of the vaccine was, in fact, what was studied in the clinical trial supporting its authorization. And I was on that FDA committee meeting and the subsequent meeting of the US CDC. And the representatives from Pfizer walked through this with extreme clarity and detail. So it's not correct to say that they could not answer. Finally, every parent or child who receives this vaccine will receive the EUA fact sheet that was authorized and approved by the US FDA.
Jeff, thanks for your call. And Dr. Shah, thanks for being able to clarify that. An email here from Priscilla about the variants. Is there one that is causing all the hospitalizations? Do you have a way of testing to find out what variant causes the illnesses?
Yep, Priscilla, the answer, it comes down to one word: Delta. 99.99% of all the cases in Maine, indeed almost all the cases in the United States, are caused by the Delta variant right now. Now, Maine has been leading the way throughout the pandemic on sequencing all of the samples, not all, as many of the samples of cases that we can get. By sequencing, I mean looking at the DNA fingerprint, or with COVID-19, the RNA fingerprint, to try to determine which lineage or variant it is. And what we've seen resoundingly in Maine for weeks, months now, has been that almost every single case, and thus almost every single hospitalization, is accounted for by the Delta variant.
All right. An email here from Jay. With the opening of the Canadian border today, how do you see this affecting COVID rates in the border counties? It would be worth noting that New Brunswick and Maine have about the same population, but New Brunswick has much lower cases.
Yeah, agreed. And this has been something that my team and I have talked about. We don't see it greatly affecting the situation of COVID-19, even in the border counties. A lot of the folks that have been going back and forth have either been doing so or will have taken the necessary precautions, namely the fact that they have to get vaccinated to be able to cross over the border, the land borders into the United States. So those fully vaccinated folks coming over from New Brunswick, for example, aren't likely to be significant contributors to our cases here. More generally, Joe, we've seen now for 2 summer tourist seasons that Maine can accept individuals coming into our state and not have that contribute to an overgrowth in cases.
All righty, let's see. I think I'll go to Deantha calling from Bridgeton. Hi, Deantha, go ahead.
Hi, thanks for answering my questions, or at least my comments. I have graft versus host disease from a bone marrow transplant 5 years ago. And so I have a very compromised immune system. And my doctors encouraged me to get the booster. I had the 2 Moderna shots. And after the 2 Moderna shots, they did my antibody test, and I had about 700 of them. After I got the 3rd shot, they did another antibody test, and I had well over 10,000. So I'm very much a proponent that the booster does in fact work, and that it does, cover your body for protection. And that's all I had wanted to say, is that I wish more people could get vaccinated for my sake, so that when I go out, I don't have to always wear a mask. I feel so weird going into places that say, no mask required if you're vaccinated. I'm like, well, I'm vaccinated, but I carry oxygen, and so I'm wearing a mask because, I don't want to get it. That's all I had to say. Thanks.
Well, Deantha, kudos to you again for getting a booster. It's a great way to take care of your health, make sure that you're staying safe. And Deantha, I really like the point that you made. I think it's a really important one that we sometimes lose sight of. The thing with vaccines is that not only do you benefit, but other people around you benefit. That is indeed what the entire concept of things like herd immunity is. The more folks that get vaccinated, the less room there is for the virus to run. So by getting vaccinated, we all protect not just ourselves, but others around us who, like Deantha, may have a compromised immune system, or who are elderly and whom the vaccine's effectiveness may have waned a little bit more, or, for example, around children who are still too young to be vaccinated. By taking that step of getting the shot, we protect not only ourselves, but also our broader community. I don't think that can be underplayed at all.
Deantha, thanks for your call. We'll move on to Machiasport and Margaret. Hi, Margaret, go ahead.
Hello.
Yes,
go ahead. I was wondering if you could address issues of trust that people might have with pharmaceutical companies like Pfizer in light of the opioid epidemic and their Trovan drug trial that they did in Nigeria, where dozens of children were injured in that clinical trial. What safeguards are in place to make sure that these pharmaceutical companies aren't taking advantage of their influence and regulation?
What a thoughtful question, Margaret. Thank you for raising that, because you're right. We should always be making sure we're asking tough questions, whether you're a parent asking about the safety of the vaccine, or in this case, concerned citizen asking whether we should trust the process that led to these vaccines. And I'll share with you why I trust that process. And of course, you're right that some pharmaceutical companies have engaged in things, be it around the opioid crisis or prior clinical trials, that were dishonorable. There's no question about that. The question now is, in light of all of that, can we still trust the vaccine, even though we may or may not trust the company? And that comes down to the regulatory process that looks under every single rock and kicks every single tire to make sure that the data makes sense and to make sure that it's all been vetted. Let me give you one really quick example. One of the things I used to see on Twitter a lot was after a company submits its data to the FDA for the EUA, whether it's Moderna or Pfizer, people say, well, now, gosh, FDA has the data. Why can't they just go ahead and meet and approve the darn thing? The reason they don't do that is because FDA takes that raw data from the company and breaks it down completely and rebuilds all of the analysis on their own. They don't just trust what the data say from the company's perspective. They break it down block by block and build it back up with their own team of scientists and their own team of epidemiologists to see if it really adds up, to see if the conclusions are there. And if they are, then they move out. And that process takes some time. That's why, for example, I trust the work that the FDA and then subsequently the CDC scientists undertake, because I've been in on those meetings and I've listened in on their deliberations, and they kick the tires extremely hard. If there were a problem, I have faith and confidence that it would have been uncovered. The last piece that I'll mention is that these studies don't stop when the authorization comes through. They continue. They're what's called phase 4 or post-marketing trials that continue to monitor people so that if there weren't a side effect that was uncovered in the first trials, it will hopefully continue to be as the trials go on. So the work doesn't stop once the authorization has been granted.
Margaret, thank you for your call. We're going to go to Ashley calling from Belfast. Hi, Ashley. If you could be quick, that'd be great.
Hi, Jennifer. Thank you so much for having me. I just wanted to ask about vaccinations for children under 5. My son is 2, and so, we have a long time to get to that point. And as more people get vaccinated and he remains unvaccinated, I do have concerns about his safety. So any information on that would be great. Thank you.
Yeah, Ashley, that's a great question. I know it's on everyone's mind as well. Here's the latest. The next 2 phases of the Pfizer vaccine are going to be as follows. From kids 2 through 4, as your child appears to be, and then for the last phase, or the next phase, from 6 months up to age 2. The study for that first group, kids 3 through 4, underway right now. And based on what I've been briefed out on by Pfizer and FDA, the company is hoping to submit the data at the end of the year or at the beginning of next year through that same process of review and analysis that I just talked about in response to Margaret's question. And then after that, sometime in 2022, will be that last group for kids 6 months up to age 2. But that next group where your child is, probably the first quarter or second quarter of next year.
All right. And because we have 30 seconds left, Dr. Shah, if somebody wants to know where they can get their 5 to 11-year-old vaccinated, where do they turn?
The best place to go is on our website. We have a website that lists all the places where kids can go to get the shot. 20 minutes ago, I told you it was 82. Since then, we've added 2 more. So we're up to 84 places, as promised. The best way to find that website really is to go to your favorite search engine, whatever that may be, and search for Maine COVID Vaccine Finder, and it'll take you right there, and you can look for your county and find the shot.
Well, Dr. Nirav Shah, as always, thank you so much for joining us on Maine Calling. Dr. Shah is director of Maine's Center for Disease Control and Prevention. Today's sound engineer was Sandra Harris. We want to thank Nick Godfrey for bringing us onto your YouTube channel or onto our Facebook page via Zoom. Maine Calling is produced by Jonathan Smith and Cindy Hahn. This program will re-air tonight at 7. Tomorrow on the program, how climate change is linked to extreme weather. I'm Jennifer Rooks, and you have been listening to Maine Calling on Maine Public Radio.